I'm Dr. John Willardson, and thanks for watching. So here, we would like to continue the topic of who is a candidate and who is, how do we go from a patient who's losing all of their teeth or missing their teeth or have broken teeth, broken down mouths, and restore it to normal, natural function. And so here is a patient, kind of a typical case again, where he's had a lot of dentistry done. He's had, crowns and bridges and root canals and extractions and all kinds of stuff. So he's spent plenty of time in the dental chair, plus, of course, spent a lot of money as well. And so let's take a look at this case and how we go, what is the thought process behind the design and the execution of doing these sort of cases. And so we'll take a look here. This is just some before photos of, we've got some periodontal disease, loose teeth, broken teeth, bridges, old crowns, broken fillings, missing teeth. So we kind of have everything going on in this one case, which is a typical case of ours. We do see everything, because by the time the patient gets to me, they're pretty down and out. They spent a lot of money and time in the dental chair, and now it all has to be removed. So here is an x-ray of the situation where, and again, we tailor each treatment plan according to the needs of the patient. That's why it's difficult to quote a fee over the phone. For example, if this patient were to have called our office and say, how much is our dental implants? It's tough to answer that question, because here, now that I have an x-ray, I can say, okay, well, we've got to build this bone here because we've lost a lot of bone in the back of the jaw on the right-hand side. We have to extract, all of these teeth. So there's a lot of variables, and then the number of implants that we're going to place, which would be six on the bottom, 6 on the top, because his molars are we've lost all of the bone around the molars on the upper back jaw, and that's where the maxillary sinus is, where the sinuses are. So in his case, once these teeth come out, we have to build that bone up in the sinus in order to provide him with an ideal aesthetic and functional long-term situation. And so here we have and again, I custom tailored this case per this patient. And you'll notice I left 4 natural teeth on the lower. Why did I do that? Because I was able to make him a temporary that feels more natural. And even though, like in some of these like big box implant centers, they'll load these implants on the same day, but sometimes those, when you prematurely load it, you can have a failure. And we do immediate loading all the time. But in this case, my torque values were not high enough to put an immediate loaded case on these implants. So I had to transition onto just left these natural teeth in, which I'll be extracting, and then made him a temporary on those natural teeth. But you'll notice here we've got we've got 6 implants on the upper, 6 on the lower, sinus grafts on both sides. So we're getting on the path to getting this patient to restoring his mouth to as close to what it was like before he lost his teeth, meaning how it feels and how, food impaction. Because when you put a large, basically screwed down bridge, implant bridge, a lot of times there's so much food impaction, you're digging out the food after you eat. And that is one of the issues with implants, but we try to tighten up that implant to tissue connection as tight as we can to minimize the food impaction. And so we've got our implants here in place, and we were able to fill up any bone defects and just treat every single issue that he was having according to his needs. And we're still under construction with his case, so I don't have the final photo yet. But the reason I wanted to show this was so that we can visualize that every case is unique. We have to treat it individually so that we can get the most optimal results for each patient. Now, as far as the implants that I used in this case, we used the Straumann BLX implant, which is a wonderful implant in how it drives into the bone. And if you can see here, these threads are very aggressive, and it's considered what's called a bone screw. And so what I like about this implant is I can get a lot of fixation of the bone. I can engage that bone really well as the implant drives into the bone, and it actually pulls itself into the hole that I've made. The implant just pulls itself into what we call the osteotomy, or the hole. As well as I get very high torque values on a situation where the bone isn't quite as dense, because I'm engaging as much bone as possible as I'm placing this implant into the hole, or the osteotomy. The other benefit is I don't have to remove a lot of bone. Like in this case, there's this drilling sequence, and we go from like a 2mm drill to a 2.5 to a 2.8 and increase the diameter of the hole slowly but each time I go with the drill, I'm removing bone. And our goal is to minimize removal of any bone if possible. And so by minimizing the removal of the bone, I can actually, it's called osteocompression, where we're expanding the bone, and that way I can drive this implant and the bone kind of is elastic and it'll kind of go back around the implant. So the Straumann BLX implant is a wonderful implant. It's a very high quality, commercially pure, grade 4 titanium. It's not an alloy, it's a commercially pure titanium. And then the design and how it drives into the bone it's a really awesome implant. So this patient has had a lot of dental work done. He's had crowns, fillings, root canals, bridges, extractions. So it's not like he hasn't tried to maintain and keep his teeth in check. But over the years, and actually once you lose that first tooth, it's the beginning of a snowball effect to where you really start to have issues. So my advice is to replace, if you have a tooth that's missing, replace it with an implant. Anyway, so back to this case. So you'll notice here, he has some bone defects. So for example, this molar here on the lower right-hand side, the body's been trying to eliminate that tooth for a long time. And what it does is it destroys the bone. The periodontal disease and the acidity that occurs after having that bacteria just sit there over time, it just eats the bone away. And in this case, it's really done a number on his mandible, or his lower jaw. We've lost a lot of bone around that tooth. In fact, if you look at the cross-sectional view here, it's completely gone, the bone, because that tooth was, it's been struggling for such a long time. And it's struggled for a couple of reasons. One, due to periodontal disease, but also due to overload, because that's the only place he can chew. He has no teeth on this side, on the bottom to chew with, missing some of the molars on the upper. That's really the only spot that he can chew. So it's just getting pounded and overloaded. And so, anyway, so in this case, we have to remove all of the remaining teeth due to gum disease, as well as failing dentistry, bridges, failing root canals, and some decay. And so we'll take the remaining teeth out, and when we do that, so once I pull these teeth out, a lot of these corporate implant centers, we'll call them, will do what's called a alveoloplasty. They will level off that bone and cut away a good 4, 5, sometimes 7, 8 millimeters of bone, which is a lot. We don't do that here, because what that does is it creates a scenario so that the prosthesis, or the teeth that replace the teeth we're extracting, does not represent at all what they had before. So we want to try to take the situation they have and how it feels, and make the new set of teeth kind of match what they had lost. We call that biomimetics, meaning we're trying to mimic what they lost. So mimic the natural teeth that they lost. And that's what we do here at Trust Implants. Try to mimic the way it feels, the functionality, the aesthetics. And obviously, we want the aesthetics. We're not going to match the aesthetics of the teeth that we pull out, but just how it feels and the amount of bone reduction and where the implants go and the design of the case. We want to try to mimic nature, biomimetic, as much as we possibly can. And so therefore we treat each case accordingly. All right, so here we have our before CAT scan. The teeth are in place. We can see there's a lot of stuff going on. If we look at the upper molar, The bone also completely pulled away from it. Looking at the sinuses, the sinus, or the Schneiderian membrane, which is the membrane that lines the floor of the sinus, is inflamed because of the teeth. So I know that when I pull that tooth out, that inflammation is going to go away. Or when I pull this molar on the lower out, when I clean out that defect and all the soft tissue that's going to be inside this hole in the bone, once I clean that out and I'm down to good bone and I graft that, it's going to regenerate. And so what we do here is we plan the case out and get everything ready so that on the day of surgery we're able to go in and extract the teeth, have a set of teeth ready. So we'll make impressions of his mouth now, and then we tailor it to a more ideal situation, both in color and shape and size. But we do try to mimic kind of the shape and size a little bit of what the patient had before we started. And so, and now let's take a look at his after, and we can kind of look at what we did. So in this case, we extracted all the teeth. I've placed 6 implants on the upper, 6 on the lower, sinus graft on both sides. Notice my distribution of implants. I don't have implants at an extreme angle like they do with the All-on-4. I have vertically loading implants so that when he bites here, the forces go down the axis of the implant and it's not an off-angled situation. And then we've got sinus graft and then the 6 implants. Now this is going to be a outcome that will last him the rest of his life. And so I did leave a few natural teeth, which I used for a temporary, again, to try to, we don't want to disrupt, or we want to try to make this as smooth as possible, their process going through this. And so by making him a temporary on some of the roots that were left behind, and I will be removing those once we get to the final, but I figured while I was in surgery on his case, let's just leave him and then we can make his temporaries while implants are healing. Bone grafts are healing. We got some large bone defects, so I needed some time for these to heal. And we do load cases sometimes immediately, meaning put the implants in the bone and then make the teeth attached right away, same day. But there are cases we can't do that with. So in his case, when I was drilling into the bone, I could feel that the density wasn't quite like I wanted it to be. And so, and for that reason, I left those remaining roots in there. And so, we put the implants in the bone. And again, we talked about the Straumann BLX implant, which is what I used in his case. And the preparation of the hole, when we're putting these implants in place, I can not remove as much bone. I can compress the bone rather than remove it. And that's really all the difference is. So, but I get a good purchase of the screw or the implant as it drives into that bone. I can feel that resistance back on the implant as I'm placing it. And so I get really high torque values when I'm placing the Straumann BLX implant. So we only use the very finest implants, graft materials, prosthetic materials, restorative materials. And so as a result, we're able, and plus the design and how we envision the case when we're designing it, that all ends up creating a scenario that will last this patient the rest of their life. And so it's a wonderful thing to be able to do this for patients and to see their eyes light up when we finish it up and complete what they have trusted us to do through the process of treating them and restoring their mouth and their smile. Anyways, just wanted to go over a kind of a typical case here at Trust Implants, and it's a wonderful thing that we're doing here. I love to help these patients get their mouths restored, restore their smile, restore their life, and get their ability to chew and eat and get back to normal, what they had lost when they lost their teeth. I'm Dr. Willardson, and thanks for watching.